I'm Dr. Jeff Smith, author of the book, Living Pain-Free, It's Your Choice. That means I literally wrote the book. Did you hear me? Wrote the book on living a pain-free, chronic pain, chronic disease-free lifestyle. We're here to talk about that today, how our clinic treats our patients metabolically and neurologically to rid themselves of these problems. Let's go through this a little bit. Now, some of you out there are watching this video, or some of you are watching it for somebody else that might have a chronic condition or a chronic health care disease or something of that nature, that you've tried medicine, you've tried drugs, you've tried different types of doctors and surgeries, and just you're not getting over the problem. Or maybe you've taken so much medication that now you're sick from the medication. Maybe the medication makes you partly well but not completely well. You ever wondered why you can't completely get over that problem? Why you can't completely rid yourself of that disease, that chronic pain or that chronic disease? We're here to talk about it today. In our office, we treat our patients both neurologically and metabolically. Now, what that means is essentially we analyze the brain, the central nervous system, and all the metabolics within the body, hormones, blood work, panels, all kinds of things, immunity, stresses, all those kinds of things. We have a solution to chronic health pain, chronic disease, and chronic disease. Okay? We look at things from a metabolic and neurological standpoint. Now, what does that mean essentially? When you come in to see us, we're going to do 4 basic screening tests. Those screening tests are going to tell us whether or not you're a candidate for our program or not. And if you are, we may be able to help you. I'm here to tell you we leave no stone unturned. If you have chronic disease or chronic pain, we are going to test you, examine you, do things that most doctors don't know how to do to figure out what is the actual cause of your problem, not just why you're having those symptoms. Okay? For example, when patients come in with chronic pain or chronic disease, we'll run blood work on them. Okay? Thyroid panels, complete metabolic panel, lipid panel, or CBC with autodifferential. Now, I hear this all the time. Doctor, I've had those tests. My doctor said they're fine. Why are you still sick? Give you an example. Thyroid gland. The laboratory on the sheet of paper you get says it's normal from 0.5 to 5.0. Do you know what functionally normal is? Or what is optimal for you? It's 1.8 to 3.0. If you're 1.2, the lab says you're fine. Why are you still sick? Because 1.8 is the minimum. You're hypothyroid. You're not having enough thyroid in your body. We're going to run these tests and analyze them. These conditions can result from years and years and years of metabolic or neurological problems, problems in the brain or problems in the body that just aren't being addressed through medication. We're going to run sensitivity testing on our patients. Why do we do that? Well, for instance, if you're allergic to wheat, gluten, milk, soy, eggs, or dairy, your body essentially is going to have an allergic reaction every time you put those things in your mouth. Now, how do you know if you have those things? You run the test. You have to run the test. Okay? Here are some examples. For instance, if you have any sensitivity to those things at all, gluten, soy, milk, eggs, or yeast, you could have chronic pain or chronic fatigue, which is exactly what we're talking about today. You could have frequent indigestion, that feeling of bloating after you eat, which is just horrible. Everybody has that feeling. Frequent loose bowel movements or constipation. You could have ulcers in your mouth. You could have sores inside your mouth, or you could vomit often. That's just from having a sensitivity to those types of things. And unless your doctor knows to run those tests and knows how to analyze them, you're never going to know. You're never going to know. And if you have those sensitivities, you better believe it's going to affect your chronic pain or your chronic disease. Oh yeah. Adrenal stress index test. It's called an ASI test. Why do we run that test? Well, if you suffer from insomnia, for example, this test will measure your cortisol levels. Okay? Your cortisol is important for a lot of things. For one, if you have too high of a level of it in your brain, it will eat away at your brain tissue. And it's also the single thing that's responsible for making you wide awake at 3 a.m. at night and dead tired at 3 p.m. in the afternoon. That simple test tells us what those levels are. Okay? Autoimmune disorders. Now, autoimmune conditions are very serious. Okay? How do you know if you have one? Well, there's a test for that. For instance, Your autoimmune system in chronic pain or chronic fatigue or chronic disease patients, if you test positive for the thyroid antibodies TPO and TPG, if those are in your body and they're too high of a content, you're suffering from Hashimoto's disease. Hashimoto's is an underactive thyroid, and it's not because you don't have a good working thyroid gland, because you don't have enough thyroid in your body. It's because your immune system is attacking your thyroid. So you don't treat that condition by giving someone thyroid medication. You fix that condition by treating the immune system, which is attacking the thyroid gland. I hope that makes sense, because you want to treat the cause, not the symptom. If you suffer from tissue antibodies, for instance, sometimes parts of your immune system flat won't work. We need to know why. Why is that? Okay? We need lymphocyte subpopulation, Th1, Th2 cytokine panels, and natural killer cells. Those immune panels give me an in-depth picture of exactly what's happening in your immune system and how your immune system is affecting both your chronic disease or chronic pain problem. H. pylori, Helicobacter pylori, it's a bacteria we all have in our stomachs. Okay? We should have a certain amount of it. When you have too much of it, things get out of balance, out of proportion. For instance, if you have too much of that in your body, you'll suffer from what's called leaky gut syndrome. Leaky gut syndrome is a condition where altered or damaged lining of the bowels caused by antibiotics or toxins or a poor diet or parasites or infection can lead to permeability of the intestines, or in other words, your intestines will leak into your body cavity. Now, you know what happens when your appendix bursts? It's the same type of principle. If this is leaking into your system, it's going to make you terribly ill, chronically sick. Okay? Your immune system is what controls that. We also test for neurotransmitters. Do you have the proper neurotransmitters in your brain? Is your brain communicating with the heart, the lungs, the kidneys, the adrenal glands? The neurotransmitters are vital for brain function, because a decrease in those neurotransmitters will cause an increase in pain. So if you suffer from chronic pain and you don't have enough neurotransmitters, your pain's going to be even higher. Okay? Hormone panels. We use hormone panels to check to see if a patient suffers from low progesterone or low testosterone in males. Yes, males have hormone problems too. Very common. Okay? That can include symptoms like depression, fatigue, fogginess of the mind, or mood swings. If you have chronic problems like a chronic disease or a chronic pain, your hormone levels will vastly affect that condition. And without the proper test, your doctor won't know how to repair it. Okay? Inflammation. We test for inflammation. If your body has inflammation in its brain, it'll literally kill you. You have to run the test to find out why. And more importantly, how do you fix it?